Hi, welcome. This is section 3 of our IVF webinar. My name is Megan Crowe. I am one of the IVF nurse coordinators with ORM. This section is going to review the egg retrieval. In preparation for the egg retrieval, we are going to ask that the day before you hydrate really well, you eat really well, because we're going to have you not have anything to eat or drink after midnight until the egg retrieval is complete. The procedure will take place at our 808 office location, and you can expect to be here for about a total of 2 hours from arrival to discharge. We are going to ask that you do have a ride home that day, no cabs, and that's just going to be a rest day. The day of the egg collection is going to be just a day for you to take to yourself. When you do check in, you will get a set of vitals on you. You'll also be asked to change into a hospital gown. We will start an IV as well, which is where your fluids as well as the medications for the anesthesia will be administered. We do ask that you not wear any perfumes or any kind of fragrances in the surgical area, no contact lenses, so do bring glasses if you do need to wear those. We do generally ask that there's just one person in the recovery area, and that we do ask that children stay at home. You will be asleep for the procedure. The anesthesia is a mixture of pain relief as well as relaxation. You will meet with the anesthesiologist prior to the procedure, talk about any surgical history that you may have, any kind of concerns that you do have, and then note that there is a separate payment for the anesthesia that goes out to the organ anesthesia group. The day of the retrieval is going to look very similar to the ultrasounds that you have had. So it's going to be ultrasound guided. Attached to the ultrasound wand is going to be a needle, and that essentially is going to puncture the back wall of the vagina and go into the ovary. And essentially, the physician will aspirate the follicular fluid into a test tube, and then that test tube is going to be passed to our embryology team to look under a microscope, which we have a video that we'll be showing you later. The actual procedure itself only takes about 15 to 30 minutes, so it's pretty quick. There is a rare possibility that you could possibly ovulate prior to the retrieval, but that is very, very rare. The day of the retrieval, you'll know how many eggs were collected, and then the following day, you'll get an updated report from our embryologist. So this is an egg retrieval video that we are going to watch. So what you'll see is that is the needle that is going into the ovary, and it is just aspirating that follicular fluid. And the provider is going to go into each follicle. This person has a very good count, but it is of course individualized. And it's a very quick procedure, but again, you'll be asleep for it, so you won't remember any of this. The provider will go into both ovaries if you do have 2 ovaries, and we will collect as many follicular fluid and hopefully as many eggs as possible. Not all follicles will have a mature egg in them, though. Another common question that we do have is if the follicle ends up being small, is the provider going to retrieve that? And most certainly we will. This next video is going to be just a video about the embryology lab. So we saw the retrieval, and now this video is going to show what the lab is doing. So in that video, we saw that there was a surgical nurse who was scrubbed in with the provider, and that the follicular fluid was being passed to the embryologist, and the embryologists are looking at under the microscope, hoping to find an egg, and we do use the Bell system despite all of the modern technologies that we have. That indicates that we are getting eggs to the physician, but partners, family, be aware that you won't be able to hear the bell outside. If we are creating embryos, then we will need to have a semen sample the day of the retrieval. So that is going to be when the egg and the sperm will meet up. Whether we are having somebody produce a fresh sample or if it's been a previously acquired frozen sample, whether it's donor or if we froze some sperm ahead of time for the partner. If you are producing from home using that fresh sample, then we do want to make sure that it's within 45 minutes of the time it's produced to the time it's in our office. And it does also need to be completed in one of our sterile collection cups. Otherwise, we'll have the collection room that you'll go into when the surgical procedure is taking place for your partner. We do ideally prefer 1 to 2 days of abstinence. So just a good rule of thumb is the day that you trigger, that would be a good day for the partner to produce a sperm sample and then through ejaculate and then abstain moving forward until the retrieval. After the retrieval, you're going to get a detailed post-op instructions, and this slide just kind of outlines potential avenues that you could be undergoing. So if you are freezing eggs only, that day you again will be going home, taking it nice and easy. That's true for all of these scenarios. Usually we would have you set up a follow-up discussion with your physician to discuss the outcome of the cycle and to make sure that your fertility preservation goal is met. We would expect about 2 weeks after the retrieval, you would get a period, and you would want to notify your team about that. If you are proceeding forward with a fresh embryo transfer, so meaning 5 days after the retrieval, we are transferring back an embryo to you. You will get a new calendar at that time, so that will be reviewed, and there's going to be some additional medications that you will start at that time. If you are proceeding forward with a frozen embryo transfer, what is going to happen is about 2 weeks from the retrieval, you will get that period. And with that period, you'll want to call in because we do want to notify, you want to notify our team about that period start. And then we can look at getting you set up for your frozen embryo transfer, which there's a couple of different transfer cycle types, which your coordinator will review those with you. Usually also we set up a discussion with the physician to talk again about the cycle outcome and then talk about the transfer plan. The day after the retrieval, you will get an update from the embryologist, whether if it's just that we are freezing eggs or if we are creating embryos, you'll get your fertilization report. And then they will outline the follow-up times that you should expect to receive a phone call. I do appreciate the time that you spent in section 3, and if you do have any follow-up questions from this, please let your coordinating team know. Otherwise, please tune in to section 4. Thank you.